Good morning, this is Dr. Timothy Scott back here at LifePoint Medical. It's October the 5th of 2021 and everything is full go here. Even the rain has got us. We've got our wraparound drive-through going, but I think we're running them through the overhang out here so everybody doesn't get soaking wet. We're still testing for the COVID-19. We still got the door locked out front, limited access, and there was one uptick with a death overnight. I don't know who that was. I'll try to figure that out just so I know who it is, but that's sad to hear with this Delta variant wave that we've got going through here. It does, like I don't seem to have any active patients that I'm aware of who's got the COVID sick now with it and being sick, okay? And so I'm praying that this thing is gently leaving the community or saturated the community or whatever it's got to do to move on. But keep your guard up, okay, on that. Let's talk about an interesting thing that I do quite often, and I want to educate you about this a little bit because it is a function of our office, and that is called surgery clearance. Okay, and what happens there is you might go see a specialist or a surgeon who wants to do surgery on you, and almost 100% of the time they're going to want a pre-surgical clearance. And they also do their own pre-surgical clearance. So you got really two that you normally have to do. One, you have to do one from your primary care doctor, which would be me, and the other one would be through anesthesia. But what happens is, what we need is we need the request for pre-surgical clearance, and also we need from the specialist what exactly they want, because some of them want one thing and some of them want another. So what we do is we'll get that request, and then we'll call you for an appointment. And if we can do everything at that appointment, in other words, we've got all the stuff they want for the surgery, we can clear you right then, or at least give you a disposition. When you say clear, I really don't clear people for surgery. What I do is I give my opinion about your risk related to the surgery. It can be low risk, moderate risk, or high risk for the surgery. And plus the surgery itself has something to do with the risk. In other words, if you're getting a toenail removed, so that's a low risk surgery, and you're probably going to have low risk for complications, where if you're having let's say coronary artery bypass, or you're having a big surgery, then the surgery may be high risk. You may be low risk, medium risk, or high risk for complications related to that. Of course, as you get older and all that other stuff, those factor into that. But anyway, on that first visit, if I can do a physical, if I have all the information I need to provide them, I can knock it out then. However, sometimes I can't. I've got to order and get set up for whatever they want to see. Most of my stuff that I check annually on people covers what they need. It's just sometimes they may want it within a month prior. And if you haven't seen me in a month, or we haven't done all that paperwork in 6 months, then I have to repeat exactly what they want. And then you come back, and then I have to write in the note your disposition when it comes to this. And I have to actually document it in the note with the physical exam and your medication list and all this other stuff. Plus, a lot of times I will give them special instructions to the surgical team if I think you're at high risk for having complications related to one thing. Let's say you have COPD or you have asthma. I'll tell them, hey, make sure you monitor their breathing around the time of the operation, or if you're high risk for having clots, or you've had clots, or if you're on anticoagulation and we need to stop it. All these kind of things I do is I tell the surgical team, hey, you might want to watch out for this, or you might want to watch out for that going in or around this surgery. So that's called a surgical clearance or pre-surgical clearance. So I just want to let you know that we're here for you on that. And again, a specialist or a surgeon is probably going to ask that of me for you when it comes to surgery. Alrighty. And another thing, when you do have surgery, when you get in the hospital and you have surgery, particularly if you have a prolonged hospitalization or a major surgery, I also want to see you as quick as possible when you get out of the hospital. And that's because I want to go through your medications mainly and make sure they haven't been mixed up, because there is a little weakness in our system. In other words, when you get put in the hospital, We will sometimes drop meds and add meds based on what's going on with you. And then when you get discharged from the hospital, we'll give you a new list of meds, and it may or may not contain the ones that's already been dropped. So, and it may be a maintenance medication. It may be something that you didn't need to be on while you were in the hospital due to complications and things like that. Very common one's metformin. We almost always stop a metformin when you go into the hospital and use insulin because it has less side effects. On the flip side, we want to start that metformin back when you get out of the hospital. And that's why I come in, and if you can see me and make an appointment, I'll go through your records and at least reconcile your medications, make sure you're doing okay, make sure there's no complications. And if you are having those troubles, I can actually call the surgeon who did the surgery and tell them what's going on and say, hey, I'm really worried about this patient because of X, Y, and Z. Or I might say, you really need to see this patient. They're not doing that well. And I do that all the time, and it's completely appropriate. And I'm just helping them out, actually. I'm helping everybody out because even the surgeons don't want to have a patient at home and not doing well. So I'll alert them and we'll get you back there. Anyway, that's a story on pre-surgical clearances. It's something we do here. We love to do it, and we love to look after you when you have to have something done. You have a wonderful day, and you please call us if you need us, okay? Thank you.